We give you praise, we honor, magnify, and adore you in Jesus' name. Amen and amen. Bless the name of the Lord. You may be seated. I hope that you greeted somebody. Good. This evening, we are going to have this session that we could not have last week, the discussion, which has been organized by the marriage ministry. We want to say thank you to Michael and Natalie Beckles for putting this together. I think that the topic is excellent. It is necessary. And we have with us Minister Sinclair Brown, who will be coming to share. And this will be a discussion that we will have this evening, not just a talk fest. And I really want to encourage us to share. You know, we like to wait till as the thing ready to end to bring enough questions to ask. But this can be a time where we can get some really valuable information, and I really want to encourage us to do so. Brother Sinclair is no stranger. In fact, he attended the West Indies School of Theology, was in Pastor Jeff's class, I believe. And today we are happy to have him to come and to share from the pulpit. So, Minister Sinclair, we want to encourage you to come. Please feel free to share liberally with us. Bless you.
Good evening, everyone. Thank you for the invitation. I look forward to sharing. And as soon as the doctor reaches, please let me know, because I want to give it to her. The reason being for that is that menopause, I'll be speaking on andropause, but I really want to touch before I begin on menopause, because so many women are going through menopause and have no idea about it. Yes, and I am a counselor, and because taking into consideration how things affect behaviors and emotions, I also had to take in the medical understanding of persons. So menopause and understanding this thing called perimenopause, which is the season before menopause. Then there is menopause, and then there's post-menopause. Yes. So I'm going to let that sink in for a second. So we don't even know that there's something called perimenopause, which is easy 10 years before. And that, once again, that is subjective. And once again, there's a number of reasons. So what age do you go through menopause? That is also subjective. And that is a conversation that should be passed on by the women in your family. So the idea that women are great communicators, I want to challenge that. Because the truth of the matter is that the DNA of your parents normally gives a good indicator of when you also will go through menopause. So that's one of the reasons so many women are almost caught and they know that many of these symptoms that they're experiencing, I'm sure you will hear about the others later. There's so many that sometimes we want to know, what is this? Why I'm feeling anxious? Why I have this skin condition? Why I'm having these irritabilities and mood swings and all these different things, and nobody's there to tell us what is going on. And as men also, being supportive to our women, our wives, our mothers, our sisters in Christ, if you don't know, it's very difficult for us to be on board to support you in that season. And many times that can challenge our marriages, and by extension, even affect the church. Because if you as a man don't understand what your wife is going through, and she doesn't understand what she's going through, we might just think it is a behavioral issue when this is actually hormonal issues. So anything that affects the womb and the gonad affects our behavior. So there are things like fibroids, endometriosis, PCOS, anything along that line can affect the behavior of an individual. So if a female doesn't understand that these things are affecting her behavior, she may figure, yes, I have PCOS. And she doesn't understand that that also affects how she operates in a relationship or with others. and by extension, other women don't have a grace with other women going through these experiences. Because they could be going through perimenopause, and because it's just her behavior, man, she need to get over it. At that time, not knowing that this is a real thing. And then, therefore, when we know, like I said, we as collection of the body of Christ, and beyond that, that when you're actually going through it, now we go like, oh, wow, this is a real thing. These feelings and emotions and behaviors. Once again, not every person will go through these symptoms. Yes? There are a couple of solutions, and I said I prepare myself to come after the doctor, to be quite honest. So I was going to piggyback on what some of the things she said. But I'm going to touch on the andropause that Ware was assigned to, and hopefully by the time I get to the end of that, she will be here. So there's a term that we have coined called male menopause now. And while I say there is a thing such as male menopause, I also want to say that there's no such thing as male menopause. And I will explain that. Okay, there's something we call andropause, and it's actually called low T or low testosterone. So a man's peaking his testosterone is around 20 years, 25 years or so. And after that, he loses between 1% to 2% of testosterone. So by the time we are 50 years old, we're kind of half the man that we were in our 20s. And therefore, but that is easily understood. I would talk about some of the evidence of these things, and that's one of the reasons as we get older, some may get very, very irritable and miserable, and, crumble the leaves in the yard, and dog barking, and, and that is a testosterone issue, believe it or not. The reason that I don't want to peer this as much as menopause, because while I will discuss what we go through, to say that it is a male menopause, it is not the same thing. Because with menopause, it is actually ceasing of, or coming to the end of the ability to childbirth and conceive a child at the end. Not less of a woman, but you're coming to the end of your reproductive cycle. Men do not come to the end of their reproductive cycle. The only comparison is if our testes disappeared at the end of it. And that doesn't happen, okay? So the truth of the matter is we have low testosterone, and for the most part, we have symptoms. And if we were to go to our practitioner and get tested, and to see if we are struggling with low testosterone, which is given the manifestation of andropause, it is just as simple as, for the most part, taking testosterone, which can be applied in different ways, and more often than not, our problems are solved. So I think it's a little disingenuous to say we go through male menopause. Okay? But I will go through what we go through. But once again, if we are in the body of Christ in a relationship, this could actually save many relationships by extension, and brothers in Christ as we go through this. So it goes through between our 40s to early 50s that you will see this happening. And you have mood swings, irritability, loss of muscle mass, and reduce the ability to exercise. So you find that the muscle mass atrophy start to occur. Fat redistribution, such as developing a large belly or man boobs. Yes, man boobs. Good here. Gotta get husband a bra. And yes, Jesus is Lord. A general lack of enthusiasm or energy, difficulty sleeping, insomnia, or increased tiredness, poor concentration, and short-term memory. And as we get older, if we don't understand, but testosterone is very much a precursor for other hormones and things to be able to be integrated. So if the low T, here is what is happening to the body. This is the man. So these things can interfere with everyday life and happiness. So it's important to find the underlying cause, to find out how to work out and resolve it. So we have personal or lifestyle issues. Lifestyle factors or psychological problems can also be responsible for many of these symptoms. For example, erectile dysfunction, low sex drive, and mood swings may be a result of stress, depression, and anxiety. So a person may be going through these things and think it is low T, but not necessarily, because stress can affect a man's sex drive and his mood swings and his libido. Depression can cause these things, and anxiety. So once again, it's good to have a good healthcare practitioner that you can have a discussion with, that have been tested to find out if this is what's happening. There are also other things such that will cause a man to have erectile dysfunction. And this is the thing, to be quite honest. As men, you know, that is, and I want to go too far, please. I'm not trying to make you uncomfortable. But we know that erectile dysfunction, if that happens to us as men, the world stops, okay? The whole world ceases. And yes. And I think that we need to spend more time to understand what many women are going through. Because when we talk about marriage and relationships and going through menopause, having something as simple as hormone replacement therapy can assist tremendously in with women now who are going through menopause, and could assist with that. But the reason I pause there to go on the women is because so many women are not enjoying sex within inside every relationship, and the world is not stopping. In the church. And because we need to have these discussions, there is a necessity to have these discussions. Yes? So I say for men now, coming back to the men, there are other reasons for our erectile dysfunction, because this is why we would go to the doctor. We could be losing many body parts, but that one causes us to go to the doctor, and it isn't always because of low T. Yes? Such as smoking or heart problems. This can happen alongside of psychological causes. The psychological problems are typically brought on by works. Okay, I think that's the doctor. Thank you, Jesus. Thank you, on by works of relationship issues, money problems, or worry about aging parents. And midlife crisis can also be responsible. This can happen when men think they have reached life's halfway stage. Anxiety over what have been accomplished so far, either in their job or personal life, can lead to a period of depression. Most men, when we get into our 50s, we do this thing where we start to look back. And we start looking at, have I accomplished this? Have I achieved this? Have I done this? And it can make a lot of men get depressed. And we used to have this term, I can't remember the term now, not midlife crisis, is it? But that's when, you know, we bought the sports car and, you know, open the shirt and show the chest hair and buy the chain with the eagle on it. But, and try to still be young. But that is a period in our lives when we start to look back. And it is honestly a psychological aspect. So one possible cause of male menopause includes lack of sleep, a poor diet, lack of exercise, drinking too much, smoking, as I said, low self-esteem, and other muscular challenges. So what do we do? If you're reaching these symptoms that I mentioned, where you start to feel tired and exhausted as a man in our 50s and so forth, as I said, get to a doctor, have that person you can talk to. And not all men would experience low testosterone as sperm reduction. Yes, there's a difference between sperm and semen, and we need to understand that also. Yes. So as I said, we gradually start to lose our testosterone as we get older. Sperm production does not stop. I said in comparison to men which their eggs stop, so therefore we don't go through menopause. And as I said, not all men would experience low testosterone and sperm reduction. So the similarity between andropause and as will be presented later, some of the things that we will go through is mood swings with low T, depression, headaches, night sweats, insomnia, weight gain, bone loss, decreased motivation, lack of focus, low energy, muscle loss, and mild to moderate erectile dysfunction. So you have hair loss, fatigue, testicular shrinkage, genital numbness sometimes, and sometimes that whole thing of the difficulty of erection. So here are some of the solutions. I said diet, which is exercise, is one of the things that help us to increase in our testosterone. And this is very good because the body starts to function better, you understand how the organs work, the blood flow is better, and we increase our testosterone. Our daily activities of where we actually find ways to get out of our distress. Because we get stressed all day, we have to find ways to get out of that stressful area. Because we go to work, we go to church, we go home, but many men, we don't get a chance to go to a baseline where we actually get to relax. Nutrition is very important. Having those type of foods. Many times we're consuming things, but because we consume something does not mean it is food, right? Because food is supposed to give us nutrients, vitamins, energy, and the like. So Pringles are not food. Yes. So nutrition is important for us as men. A mindset, believing what, stop comparing yourself to your past. You're not 20 anymore. So start comparing yourself and try to get strong. Try to build your muscles. Once again, once you're past 40, please don't try to do the exercises that you did when you were in your 20s. It is a whole different body. Whole different body. 35 is midlife and not 50. We got 3 score and 10. Anything after that is gravy. So 35 is midlife. So 40, when you're doing exercise at 40, you warm up, you stretch. You put in your 30 minutes, you warm down, you stretch. And that is more. Getting adequate sleep is very important for the men. I want to say getting adequate sleep. I'm so guilty of not having enough sleep, but sleep is actually a very good way of helping with low-T. So just a couple supplements. L-arginine is one of those things that I would recommend to my clients. Ornithine is another one. DHEA, and there are other supplements that I would recommend along the way to help men with low-T. And one of the main things I try to help my men with is mental health, having a positive mental health. So that way, counseling sessions, having somebody you can talk to discuss these different areas in your life when it comes to your mental health. And because, and I said this to Natalie when she called me, and we spoke just now, yes, because menopause is such a large topic, it is easy a 3-hour discussion because there's so many complexions and areas. So I will give way to their doctor because of the depth of menopause, and it affects both men and women. So the environment, this is not a female subject, but this is also a male subject. Yes, because we are both will be going through this season as a church. So it helps us to understand when our sisters are going through certain things and not just that she's miserable. Yes? Yes, please.
Mr. Sinclair, I have a question.
Yes, please.
We know that in terms of the andropause, that men do not like to discuss these topics, especially when it comes to things like erectile dysfunction, low-T, and so on. As a counselor for the wives and so on, how should we broach this topic to our spouses and so on? If we notice some of these symptoms that you mentioned, how would you suggest that we could broach this subject to our spouses in a way that would not cause them to put up a wall or become defensive?
There's none, actually. If you have a guy that is going to be offended, he's going to be offended. That's true. If you have a person, have a discussion. But nonetheless, I still think you should have a discussion. So you should approach your husband and say, recognize your libido is low. You know what I mean? I recognize you're not approaching me as much. I find you're not getting erect or you're not staying erect. Can we go to the doctor together? And or if he is willing to go to the doctor on his own. And yes, for a lot of men, that is not a discussion that many men want to have, yes, because they feel less of a man because of it. However, I think once we start discussions like this, it will make the environment more comfortable. I think it's a good thing to start these discussions so that even in the open air, and your husband is here, you give him a little knee, and you hear what the guy up front said. Can we make an appointment for next week? Yeah. But the thing is that we need to have an open discussion. Sex is a very taboo conversation. And people keep saying, we need to have an open forum. But doing this for as long as I have done it, I can understand why it is hard to have an open conversation, because it's very offensive, because sex is very much a shame-based area. And that is not a bad thing, because when a person is shameless, they just say anything, anywhere, anyhow. So it kind of keeps us in a space. However, I think the more we have forums, that we have mature people, that we have this discussion, it helps. Because we still struggle as men to get our prostate checked. Yes? And that is with a digital exam. A person taking their finger and inserting into the rectum to feel the prostate, to feel if it is enlarged or calcified, and we struggle with that. Yes? And that is something that could save our lives if we find it early. So if that is something that could save our lives and we still struggle with it, Pastor, I'm saying there's a real struggle. Imagine that. But however, my advice to the ladies is please still have a discussion, even if your husband or your spouse finds it challenging. But what I can say is come in with more of a gentle tone, right? It can't be in the midst of everything and things. Well, you need to go to the doctor. No, we can't. That is not a good approach. However, we can actually wait till it is in a better way. So, babes, I want to talk to you about something. I've noticed this. Can we look at this? Can we go to a doctor about this and get your heart checked and see what is happening in that area? Is this low T? And therefore, we could actually save many couples with that. Yeah? Doc? Yes. Anybody want to introduce her? Or no, she was right there. I mean, information so I could introduce her? Oh, you have it? Who have it? No, doctor, you wait a minute. I want to introduce her because somebody got to introduce her. Have any details? No? Thank you very much. So, Wanda, thank you very, very much.
Thank you, St. Clair Brown. What I must say, I'm still learning because, anyhow. All right, this is beautiful young lady, is Dr. Lynda Williams. I've just met her in person. We haven't had chance to really chat and get to know each other. But she is a member of Amar Empowerment, and through them, we have invited her to come and speak on menopause to not only just the ladies, but also the men. So.
Thank you. Good evening, everyone. When Ambrose asked me to do this presentation at first, I said, that's interesting. I did it a few years ago. I was asked by a Church of God in St. Lucie, can't remember exactly, no, in Mile and a Quarter, St. Peter, to do the same presentation. It was just before they made the rules of not congregating in COVID, right? So we were still coming out. And it was a Wednesday night, just like this. It was pouring rain. And it was such pouring rain that I almost couldn't get there. And I said to myself, well, nobody is coming out in this rain to listen to a conversation on menopause and andropause. When I got there, the church was packed. Young people, old people. And I was like, Lord, what is this? And I asked the Lord, I said, Lord, just give me the wisdom to be able to speak to your people about something that we don't often talk about in church. We started at 7, and at 11, I was leaving the church. That will not be the case tonight. God, thank you, Jesus. Right? But there were so many questions and discussions. And, you know, the funny thing is, a lot of men came out to ask questions about things they had noticed in their wives that they were afraid to ask. I heard the previous speaker saying, you know, when you notice something in your husband, you go to him and say, baby, let's have a conversation. But it's often not like that, is it? It should be, but it's often not like that. Because when it comes to things to do with sex and our sexual health, people tend to be a bit more reserved and not necessarily have that openness. And so it is good to have forums like this to be able to ask the questions about the female body that you never understood. I am Dr. Lynda Williams. I have been a practicing physician for 30 years. I did family medicine, and I am an epidemiologist, which means a part of public health. I'm delighted to be here with you today, and I want you to, if you're far away, come closer, right? Because we're going to have a little family chat tonight. So if you're way down in the back, come up, okay? So that we can have a little family chat. You can stop me at any time if you have a burning question. Yes, you men, come, men, come up, men, right? If you have a burning question, you can stop me. Otherwise, we'll put all the questions at the end, all right? So, let's start by defining menopause. Next slide, please. I did them in animation without realizing that there would be no control. So, next slide, please. Hello. Okay, thank you. Put them all at one time. Good. So, can you see that? Yeah. I'm not sure how many of you can read that, so if you're really down in the back, you might have to come up in truth, right? So what is menopause? Menopause is by definition a natural, emphasize natural, part of aging, when a woman stops seeing her regular menstrual period. And this happens due to a decrease in hormone levels, principally estrogen. Now God said, be fruitful and multiply and replenish the earth, but not forever. As a woman, there is a natural end to when you can reproduce. Okay? I hear somebody saying, bless God. Right. So there's an end to our reproductive phase, and this can happen naturally, meaning it happens in every woman, but it can also happen because of surgery or other things happening. So the natural way is you just come to the end of your cycle, but there's some people who that happens in a premature way. So it can happen before they're 40 years old, and their ovaries just fail to release an egg any longer. And no, we would commonly call that infertility, but it's just one cause of female infertility. Or it can happen secondary to something. As I mentioned, surgery. If you have a hysterectomy, ordinarily they would take out an ovary. Nowadays, this thinking is to take out no ovaries. Okay, the thinking was, you know, if I take out an ovary, then you have less chance of something happening to the ovary, and you still have one. But nowadays they do hysterectomies and leave the ovaries completely, because this induced menopause is a lot harsher. It's happening instantly as opposed to something happening over a period of time. So that hysterectomy with ovary removal, even if you take out one, the menopause is going to happen faster. Also, people who have radiotherapy, chemotherapy, all these things that stop the turnover of the production of eggs can lead you to have menopause. And the ovary is where estrogen is released from, okay? If you have other diseases like hypothyroidism, some autoimmune diseases, not all, and genetic syndromes are also causes of the ovaries stopping their function and the production of estrogen. So when does menopause happen? Now in Caribbean women, it's between 43 to 52. Worldwide, it's 45 to 55 years of age. But as I said, as young as 40. And what we're seeing now is that we're getting a drift worldwide. It's not just here in Barbados, but there's a drift to younger ages. So whereas before, definitely women in their 50s would have menopause, now we're seeing women as young as 42, 43. So the age is drifting downwards, and it's a worldwide phenomenon. We're not exactly entirely sure, but so that means that fertility's period is getting shorter. Okay, so less children. Because many of us know we had a grandmother that had the last child at 51, right? And that was child number 11 or something, right? Well, she got married at 18, so I mean, really? So at 51, she was having her last child, but that doesn't happen so much now. And it's not just because of birth control, but it's because menopause is coming on at an earlier age. But then there's this thing called perimenopause. And perimenopause, you have the symptoms of menopause, but you're still seeing a period, okay? And that can happen for up to 4 years before the actual menopause occurs. So you're getting all the menopausal symptoms, sometimes all, sometimes just some, and it occurs up to 4 years before. But perimenopause ends and menopause begins when you haven't had a period for 12 months, okay? So menopause means there is no more, and there hasn't been a period for 12 months. Everything leading up to that stoppage is perimenopause. So for some unfortunate women, you can miss your period for 11 months, and in month number 12, lo and behold, auntie arrived, okay? And that happened to a friend of mine. She was on a plane in a white pants. I know, it's like a dream. It's like a nightmare that you wake up. She was on a plane in a white pants, hadn't had menstruation for 11 months, and on month 12, the period was still there, okay? So you have to, and then you have to start from 1 again, right? So you gotta get 12 months from that point now to count until when menopause happens. And you know, around that time, the period is usually much heavier, right, than it was. So we'll get to the reasons for that. So if you're under 40 years of age, okay, if you're under 40 years of age, you can have premature menopause, okay, and that could be for a number of reasons. As I said, there are hormonal reasons and what we call premature ovarian failure. It's rare, but the youngest I've come across so far was 36 years old. And it's a reason to send someone to an endocrinologist. That's a person who specializes, a doctor who specializes in hormonal diseases. So if I saw someone who appeared to be going through the symptoms of menopause at that early age, they would be referred to an endocrinologist. Next slide, please. Okay, so it's far away, but maybe some of you remember this diagram from in school, okay? And that diagram is basically showing the egg is released from the ovary every month and the egg goes into that long curved tube, the fallopian tube, and it goes into the womb, and the womb, it builds up every month in the hope that that egg is going to be fertilized, and once it's fertilized, the womb is ready to nest that egg and allow it to grow and become a baby. When that doesn't occur, okay, then you have a period. And that's what the menstrual cycle is about. That whole process of egg release, it takes lots of hormones. And, you know, when I study it, I just marvel that only God could have thought of this, okay? Because it is so intricate and detailed that anything goes wrong at any point, right, it will cause disruption in the cycle. Yet we take it so much for granted. Next slide, please. So that's pretty much the same thing, but I'll probably skip this slide because you can't really see it from there. So what are the symptoms of menopause? As I indicated, you have a change in the duration and the heaviness of the menstrual cycle. So that can be one of the first things that occur. Usually in perimenopause, you start seeing the cycles come closer together. So whereas you might have been a 4-week, 28 days bang on, now you're getting a 21 day, 22 days, so it's coming more regularly in perimenopause. And also, you might have been a light bleeder, and now you have a heavy bleed. So that's what happens. You also can get a heavy mucoid discharge from the vagina, and as time goes along, that starts to disappear, and then the woman gets vaginal dryness. That's when you're actually in menopause now, right? Because you're not getting any discharge anymore. Anyone want to hazard a guess as to why you get that mucoid discharge every month? It's a natural part of the cycle. Ovulation, yeah, but what? Hello, my friends. Right? Ovulation, but it also allows you to it's making the body ready for sexual activity. That's basically what it is. Because that's how you're going to have sex. Your body lubricates itself, and then when the body says, oh, I don't need to do that anymore, so it stops producing the lubricant. It stops producing the mucus every month. So dryness is a part. Dry skin is a part of menopause, but it's kind of hard to identify because Barbados, everybody has dry skin. Some people get hair loss, female pattern hair loss, which is you're starting to lose hair right here in the crown. Anybody can identify with that? It's getting thinner, so you kind of arrange the hairstyle so that you can't see that the crown is getting thinner, okay? And sometimes it's actually, the hair is actually gone, so that's alopecia. Because of the vaginal dryness and for other reasons, the woman may now complain of discomfort during sex. So it takes an understanding partner, okay, to understand what is going on. She may not be as willing a participant, especially if she's having discomfort. One of the key things, and the one that I find that I see most common now, is difficulty sleeping. Now, difficulty sleeping is, I would say, part of our Western lifestyle, okay? And everybody's awake. Insomnia is, I've even got children that have insomnia now. When you were a child, you used to run about, hit the bed and be asleep. But now we have children, 15, 14, 12 years old, who can't sleep, right? So insomnia is a very big part of menopause, right? You may have been able to sleep really well, and now you're struggling to fall asleep and struggling to stay asleep, okay? So insomnia. Weight gain. Oh, Lord. Yes. Weight gain where, ladies? Where does this menopausal weight gain happen? Yes, hips, butt, and tummy, but especially at the tummy, okay? So that is what we call menopausal weight gain, and it's due to all the hormonal changes. And if you live a really fit, active lifestyle, it does not have to be. But it's also harder to lose weight during this period. You work harder in order to lose weight, whereas before you could have lost weight more easily. Now, hot flashes. What is a hot flash? Don't get me started. Well, you know, the funny thing is, people experience hot flashes in very different ways, okay? So it's not all standard that everybody has the, you know, that's not standard, okay? Some people get that. Some people get a hot flash only when they're rushing. Only when you're rushing to do something and all of a sudden you're drenched in sweat. Some people just more sweaty in general, okay? But the basic thing is your temperature control is now, your body is reacting to the loss of estrogen, and your temperature control, which is controlled by the master gland, the thyroid and the hypothalamus, those now are telling you that estrogen is no longer being produced, and you start to feel like a heat. Everybody says rising, coming up, okay? And you feel as if, you know, you see a lady in my office last week, she pulled out 2 fans in the AC. So I know immediately, you know what's going on, okay? Because, you know, you're in air conditioning and you're still hot. And that makes sleeping difficult as well, right? I had an extreme patient years ago who used to run in the sea at 12 o'clock in the night. And I told her, no, it's dangerous, you can't do that. But that's how hot she felt, that she felt that she had to go in the sea in order to cool off. And night sweats, you know, just waking up at night drenched in sweat. Now, we have evidence that all of these symptoms are worse when you're experiencing anxiety, okay? And anxiety, next slide please, can also be a symptom of menopause. So you might have been as cool as a cucumber person before, and all of a sudden now you can't cope with anxiety. So depression and or anxiety are common in menopause. It's the place of where you are in life as well, and where women are in this place in their life. You start to look back on the value. What is the value of my life? What have I done? What have I accomplished, etc. And with the loss of estrogen, it actually affects the way you see yourself. And some people go through a lot of anxiety and depression. It doesn't have to happen, but it can happen quite dramatically in some people. And if you suffered from depression and anxiety before menopause, during menopause, it can get worse, okay? Reduced sex drive, libido, okay? Now, some people have called menopause men on pause, right? Meaning, as we often say, the shop shut, okay? And this has caused a lot of friction in families, a lot of friction between couples, right? The shop shut, the shingle hang out, I've heard all kinds of things. You understand? So this then causes friction. What do the men do? Oh, Kadir, baby, I'm so sorry that you're going through that. Is that the common response? What's the common response? Go and find another shop that open, right? Not in the church, of course. Of course, right? But that is often the lack of understanding, and because of the lack of communication that people have. Poor memory and concentration. It's called brain fog. And what women find is that as you're aging, it's not about aging. This is something that is dramatic. You cannot remember where you put things. You cannot remember what it was you were going to do. You cannot remember what you did yesterday. You come back to do the same thing 2 and 3 times. Who can identify with this? Right? You cannot remember what your plans were, and you keep asking people to remind you to do stuff, right? That is brain fog, all right? And this too can be overcome, but we're going to talk about that in a bit. Now, recurrent urinary tract infections do happen in menopause. It generally happens. But also, because of the vaginal dryness, women feel as if they're having a urinary tract infection, right? So I always say it's important to test and find out if you really are or not just take antibiotics that somebody gives you, or that you go to a pharmacist and say, I have a urinary tract infection. It may not be, okay? And if you're treating yourself repeatedly with antibodies, then you're going to lead yourself to another problem of resistance to antibiotics. Now here's the key thing that I want you to remember. Any bleeding or all bleeding that returns after the 12 months is completed is abnormal. So you can't be in month 15 or 2 years after you had menopause and say, wait, the period like it come back. I've heard that more times than I can count, okay? And the person is there thinking that this is normal and a normal period, or they just had spotting. Any bleeding after menopause is abnormal, and urgent medical attention needs to be sought. Why do you think that is? Right, cancer, okay? So usually it's a sign, all postmenopausal bleeding we consider to be endometrial cancer. That's cancer of the lining of the womb until proven otherwise, right? So it might not be endometrial cancer. It might be just that you had a fibroid that is now bleeding, or you might have a cervicitis. There could be other causes, but you cannot ignore it because of the potential of it being cancer of the lining of the womb, or endometrial cancer. Next slide, please. So, no, go back. Go back 1 slide, please. Yes. So this is how most people think the menopause experience is, right? Suffering, hot, sweaty. It does not have to be this way, okay? But yes, it is a cause of extreme discomfort. But we're going to talk about what can make that transition easier, okay? So next slide, please. So I state it again, menopause is not a disease. It is a natural occurrence. It is not shutting the shop. It is not men on pause, okay? What makes the transition easier is patience, understanding from those who are around the woman who's going through these things. I often tell younger people about menopause. I tell them about it in their 30s, in their early 40s, in their late 20s. You know why? Because I don't want it to come on you as a surprise that this thing is going to happen. It is going to happen, just like your periods were going to come. You understand? They're going to stop. All right? And the more that you have information about what is happening and what the woman is going through, especially for men, and the more they have that understanding, the more they're able to be patient and understanding. But, you know, often women in their 40s and so forth might have teenage children. So you got raging hormones at both ends of the family, okay? You got somebody who is menopausal, and I didn't mention mood swings, but mood swings are a part of menopause too, right? All of a sudden, mommy get very crotchety, you understand? She quarreling about everything, right? And then you got the teenager who's now pushing your buttons, right? So sometimes those two things collide and you need some family counseling. But understanding from a partner, a husband, hopefully a boss, and your children, okay, can help the transition to be easier. If menopause occurs at less than 45 years of age, we start to question. As I said, premature ovarian failure is really under 40, but if you're less than 45, we would still check to make sure that it's not something else that's happening. And if the person has a full menstrual cycle and it's not slowing down and they're 56 plus, that also requires investigation to find out why they are not having menopause. I had a patient like this. She used to come in my office crying, "When is it going to stop?" And I said to her, it will stop when it's ready. It's often related to your mother's age at menopause. It's not necessarily, but if your mother had early menopause, you might have, are likely to have early menopause. If she had it late, you're likely to have it late. She said, well, you know, my mother and them never used to talk about nothing, so, right? And that's true. There was an era where it was all very secretive and hush. You would never mention anything like that to your children, but it's more openness today. People will tell the children, this is what I'm going through, and this is what you need to understand. So the thing that I found most fascinating when I studied and looked at menopause is that women in the eastern part of the world do not experience it like how we do. Yeah? So people in the Middle East and people out in China and things, and they thought, well, is it diet? Is it diet? Is it that they're eating more soy? You know, could be. Those things having sort of estrogen type hormones in them, what we call plant estrogen imitators. So yams and soy, and I'll talk about a bit more about those. They contain things that imitate. So because maybe they're eating those things in their tofu and whatever, they have less trouble. But also in the East, there is a greater understanding of the shifts and phases of life. So they already, as a society, have accepted that women go through menopause. Whereas in the Western society, she has the same pressure to produce, to be everything that she was when she was 30. All right? So the transition is often harder in North America and those places. I keep saying that we're almost in danger of medicalizing menopause, making it into a disease state, a disease condition, right? Because there is such little understanding of how a community of people can make that transition easier for a woman, right? And so, you know, they're always looking at what other things we can take. And that's why I said here, symptoms are made worse by psychological stress. So the more stress you are under, I talked about having teenage children, and that may be a stressor, but often women in their 40s and 50s are also caregivers to elderly parents and so forth. And so that can also bring psychological stress. If you're in the work phase still and you're still required to produce at a high level, that also is a source of stress. And these things can make the transition more difficult. Next slide, please. So, 3 things that can help you transition. 4 things. Diet. Okay? So diet that is rich in soy, omega-3, omega-6, high fiber, vegetables, and high fiber foods are shown to have less menopausal symptoms. And I gave some examples there: tofu, soy milk, fish, right? Linseed and flaxseed, chia seed, eggs, milk, dairy, peas, brown rice, leafy. It sounds like what the doctors keep saying about eat healthy. Yeah, well, that's it. Okay? So eating healthily also helps the transition to be better. So if you're still eating a lot of fast food, if you're eating a lot of processed foods, etc., This is another theory as to why menopause is worse in the West because of the processed foods, okay? And that may be causing, we may be eating things wrapped in a lot of plastics, okay? And they now think that the BPA, which is a chemical component found in plastics, is what we call an estrogen disruptor. And that causes the estrogen to fall more precipitously and you to get menopause. The recent research has been looking at things, especially in black women, right? Where the age at menopause is getting younger, whether our hair products, hear me out, whether our hair products are causing estrogen disruption at younger ages. So hair dyes and hair straighteners and lots of chemicals that we are exposing ourselves to are also thought to be estrogen disruptors, okay? So these are the theories now as to why the West is experiencing such drastic menopause. So exercise also helps a smoother menopausal transition, particularly aerobic, getting the heart pumping. Exercise is important, but also weight-bearing exercise, because menopause is associated with a loss of bone, okay? And you're more prone to getting fractures because of bone loss and what we call osteoporosis. So when you use weights and you bear weights, you use weights, to strengthen, it also helps to build bone. And when you exercise, and in general, you need increased water intake. So eat healthily, more exercise, drink more water, and sleep. So what is the thing that is keeping us awake most at night? What do you think the children are suffering from insomnia? Devices, the phone, the TV, the tablet. We're watching it until we fall asleep. The TV on in the bedroom, all of those things. These are disrupting our sleep cycles and our sleep schedules. We want to be able to try to keep to a schedule, going to bed roughly the same time every night, getting rest periods in between, wearing light clothing, particularly when you're going to sleep, making your room cool and dark, and not having any sources of what is called blue light in the room. You know what I mean by blue light? Like the computer screen or anything that gives screen feedback. Even clocks, digital clocks and wall clocks and stuff have a blue light feedback, and all of that disrupts our sleep cycles. So I tell people, turn the clock away from you, cover the computer flashing lights with a cloth. All of that will disrupt your sleep cycle if you have light on in the room when you're going to sleep. So sleep is a very important part of menopause. And managing stress, I have it here. Less rushing, more prayer, planned relaxation, and regular vacation. Okay? I'm going to say it again. Less rushing, more prayer, planned relaxation, and regular vacation, right? Those are the key things to managing stress. Next slide, please. So now we talk about how can menopause be treated. And menopause is often treated by replacing the estrogen that the woman has lost. Now, when I did medical school, there was only these pills, which would be called hormone replacement therapy. There was only pills, and that contained estrogen and progesterone. So it's mimicking what you lost when you stopped having your regular cycle, and it's giving it back to you. What do you see as problematic with that? Well, confusing the body in a way, but it helped relieve the symptoms, okay? But what this long-term study showed, called the Women's Health Study, it showed that you have greater risk of breast cancer, okay? And greater risk of blood clots from those pills that we used to have to take. And that if you had a womb, you could only take the combined pill, which is just like how you would take a pill to stop the cycle from happening during using the oral contraceptive pill. Well, this is something similar to that, except that it's just replacing the estrogen and progesterone in your body. And if you didn't have your womb removed, if you still had the womb and you just took estrogen, it would cause the buildup and buildup and buildup of the lining of the womb and make you more prone to getting cancer of the lining of the womb. So the type of pills and which pill was given had to be specifically chosen by like gynecologists, etc. But now we have moved away from some of that. And now we know that we can give very small doses of estrogen directly where you need it without those complications, without the breast cancer, without those things. And so now we can use vaginal estrogen, and you can use estrogen patches, gels, creams, and these are now safer, okay? And they'd help to decrease hot flashes, anxiety, and the psychological effects of menopause. So I have here some other things to consider. You can use vaginal moisturizers, for example, if you're having dryness. Psychological support. Sorry, that's the next slide. Next slide. Vaginal moisturizers, psychological support, family, church, understanding, counselors, etc. You can have treatment of other health conditions. So if you're going through menopause, you have uncontrolled diabetes, hypertension, cholesterol, all of those things, it's going to be much worse. So you want to manage those conditions when you're going through, and even before menopause, you want to manage those conditions to make the transition easier. And you should see your doctor regularly for screening, doing mammograms, doing pap smear, doing stool tests, all these things that are screening for cancer, because the rates of cancers in general are higher in the postmenopausal female. So, next slide, please. If you're going to cope with hot flashes, you need to stay hydrated, avoid spicy food, caffeine, alcohol, light clothing, cool bedroom, cool showers, and sometimes there are medications that you can take to stop the hot flashes from being as severe. Where there's lack of interest in sex, you need counseling, might be as an individual or a couple, reducing stress, and if necessary, may have medical treatment for depression and anxiety. Next slide, please. So menopause can look like this. Next slide, please. Or it can look like this. Okay? This lady is aging, but she's serene, she's stretching, she's exercising, etc. And she's going through it, but she's not stopping. You understand? She's just going through it. I heard the last speaker talk a lot about andropause, so I'm not going to belabor that. Next slide, please. And it's controversial, actually, whether men are actually going through a defined period of loss of testosterone that produces symptoms. And that's because all of us know a man that had children up until he was 80, right? And older, right? So it's not every man that is going to go through any kind of loss of testosterone, but I mean, all men are losing testosterone after the age of 45. It's just that some of them are not going to be symptomatic or no. I had a 75-year-old man tell me that he feels as good as he did when he was 25, okay? And he doesn't feel any different at all. So it's not like women that it has to stop. In men, they don't have to stop. The symptoms I heard him describe quite well, but you know, sometimes loss of testosterone can give you low interest in sex, erectile dysfunction, morning erections, depression, fatigue, same weight gain around the abdomen. Men might develop breasts, loss of memory, etc. And again, it's seen more in the West than in the East. Next slide, please. So this is the type of man that's going to go through andropause. Okay? Yes, he has a lot of excess weight around the stomach there, and he's got some very pronounced breasts. Okay? And that is what it looks like a lot of the time. Next slide, please. I'm going to skip this slide, except to say that, no, go back. Go back one more. Right. So I'm just going to say from this that andropause can be confused with other things. So it can look like the man is going through andropause, but it might be depression, anxiety, they might be alcoholic, they might be drug use, etc. And there's certain anti-testosterone medications that can bring on andropause. Like if you're treating prostate cancer, some of those drugs can lead to a low testosterone. Next slide, please. So you can only make a diagnosis if the man has a measured level of low testosterone and measured at certain types a day. And treatment for this, like medical treatment for andropause, is highly controversial. It should never be with something that you buy over the internet to treat low T, okay? And the reason for that is, next slide please. The reason for that is that there are risks associated with taking external testosterone. It can lead to prostate cancer. It can also lead to something called secondary polycythemia, which is a high hemoglobin level, and that can give you headaches and heart problems. For people who are at risk of diabetes or who have become diabetic and have proven low testosterone, we do treat it, and that reduces their risk of diabetes, improves mood, and improves sexual function. But those are the very few men that we treat medically for andropause. And those are all of my slides. I invite you to ask any questions, and I thank you for allowing me to make this presentation. Thank you.
Yes, yes, because I did plan, I thought it was a panel discussion, we'd be always sitting on the same stage at the same time. So yes, I'm going to share here with me whether they ask questions, because I just want to make sure anything said is valid. So I want to make sure the doctor was here before I went into so many things. But as a counselor, yes, this is one of the things that I wanted to share, that what was shared when I'm helping couples, individuals going through their seasons, that because we have a mindset of menopause being this bad thing, if you have it as a bad thing, when you go through it, it actually makes the symptoms worse. So when you look at Japan and Korea and the East, a lot of those cultures where, as you heard, they celebrate a woman going through that season, a lot of these symptoms don't exist. So it just shows that a lot of it is psychological. Well, yes, the truth of the matter that this is chemicals or hormones of progesterone and testosterone and estrogen decline. It just shows that God designed the mind, something called faith, understanding that just us understanding that this is a season that is supposed to be better and not worse, that it actually could be better. So what I'm saying is that when I'm going through with females, that it doesn't mean that your sex life is going to end. As you saw in the slide, as you had mentioned, that the pot in turned on the shingles. And therefore, there's certain things in the female body that actually becomes better after menopause, right? So actually, certain physical things that get better. One thing, doctor, I don't know if you've ever heard this, but one thing they do recommend is something called, for vaginal dryness, is okra water. You ever heard of that? Drinking it, not applying it, no, not. I'm sorry. Oh, you never heard of it? Actually, so I thought you did. It actually works. I thought you did, so I was going to toss that to you. Okra water, you slice the okra, you leave it in water overnight, and you drink the water. If you have an issue with slimy things, you mix it with your smoothies and stuff like that. So the mucus, as the doctor mentioned, is where the mucus goes into the vaginal cavity. Next section.
Right, so this brings me to my next point. There are lots of recommendations, over-the-counter pills, people take black cohosh and this and that and what have you. What works for A may not work for B, okay? And I'm not disparaging that okra water may help. Just the drinking of the additional water may be the cause. I don't know. I didn't study it, right? But if it causes you to drink extra water, then of course you will maintain the vaginal health and reduce dryness, etc. I think that might be an association in terms of okras being slimy and therefore you produce more mucus, because if you drink okra water, the slimy is going to be digested in your stomach. So it's not necessarily going to cause you to have more mucus discharge. But if you do drink more water, whatever you put in that water, you get more fluid, more whatever, it will benefit you. But yes, there are lots of recommended over-the-counter things. Some of them can be dangerous. I'm going to say that, because if you're looking at plant phenols sterols to replace your estrogen, and you do not know that you have a hormone-sensitive cancer, you say you had it and you didn't know, those things could actually make the cancer grow. Okay? And I've seen that. I've seen where a person was, she said, it's all natural, it can't hurt me. She bought a whole bunch of, isolated estrogen mimickers, right? And she didn't know she had a hormone-sensitive cancer. But, you have to eat a whole lot of yam, a whole lot of soy, a whole lot of supplements in order to get that. So my thing is, if you're going to be in that bad a stage, then go and talk to your doctor. Yeah, go and talk to your doctor. If you're that badly off, go and have a conversation with your doctor and see what is possible. You might just need the counseling, right? You might just need to go and get the family counseling, to relax, to de-stress, to whatever, right? But if you are reaching for any and everything that you read on the internet in order to treat or cause menopause, it's going to make the menopause worse, as was mentioned, okay? So the fear of it, the anticipation of it being bad. A patient said to me today, my mother went through menopause and it's bad, and I know I'm going to have it bad. Well, you just poke it out. So you have called it into existence, and therefore it's going to be bad, right? So I said to her, you're not your mother. And you don't have to walk in the path that your mother walked in, right? I wanted to say the curse can stop with you, right? But you can break off everything that your mother walked in. You don't have to go down the same road. But the fear was already producing the symptoms in her, and she was perimenopausal. Okay, so really and truly, if you have a lot of fear, it will bring it on. Somebody had a question? Oh, sorry, yeah.
Good night. Thank you so much, both of you, for the information that has been shared. It's been very useful. I have a question when you were speaking about disruptions to sleep and the effect of blue light. Now, I know lots of us now have smartwatches which you wear to bed because they test how much, you go into that deep part of sleep and so on and so on. So I wanted to have your perspective on the effect of these smartwatches on what you're saying.
So the smartwatches, most of them, mine for sure, goes off. Now, if you're steady for a thing, it will not keep, the screen will not remain on, okay? The sleep, once it goes in, it detects that you're not sleeping and not moving, it will go off. if you have a smartwatch that constantly has well, it's not smart, right? The smartwatch should shut off once it detects that you're not moving. It should go into a sleep mode and start to measure your sleep. So those usually are not so much of a problem. But if you, for example, now took off your watch, see what's here? Right, so if you took off your watch and you had this on your pillow and that was flashing all the time in the night, then that would be a problem. So any kind, so you know people have ACs in the room now? Look on your AC, it has a sleep function, and it turns off the, I can't get it back on. It turns off the blue light, that is the on button. It turns it off so that it won't disrupt your sleep, right? So if you deliberately put things in your path that disrupt your sleep, you're going to get sleep disruption. Thank you. So just be aware that all of these things. I've had mothers say the child don't sleep, the child don't sleep. And I said, what time was he using the tablet to? She said, I can't get him to stop. I said, but you can't get him to stop. You turn off the electricity, though. You understand? Take out the Wi-Fi, do what you have to do. But if these children continue to be as sleepless as they are from this age, I don't even want to think about what it's going to do to their health. It is going to have an effect. We just don't know what that effect is as yet, fully. Maybe it's all the attention deficits and things that we're seeing, right? But you cannot look at a screen up until you fall asleep. You cannot. And expect to have good sleep. You will not. Okay? And it's the commonest cause of insomnia that I see now. Any other? Yes. I think there's a mic. Oh, this here.
Yes. Oh, I have to stop now. Okay. Good night, first of all. Thank you for that divulsion of proper professional information. I was actually doing some research of my own as pertains to diet specifically and how that affects both actually. So my question mostly for the most part would actually be, which foods would you recommend? I was doing some research on specifically avocados. It said that a scoop of avocado contains a richness of boron and magnesium, and boron actually increases sex hormones as well. One of them is actually testosterone. Another family that actually increases that is the grape family as well, like prunes. And another food that also increases some testosterone levels by at least 50% I've seen is honey and mushrooms, but I'm not a professional, so some of these foods might inhibit other things that could cause increase in testosterone. So from a professional point of view, which foods would you recommend?
Right. So thanks for the question. Testosterone is produced in men and women. Do you know that? Okay. And do you know that it's only because of an enzymatic change that makes you determine if you're going to be a female or a male, which is why people can transition by reversing that enzyme so that you get less of testosterone and more of estrogen, and the other way around. So that they're forcing the body's hormones to change from one to the other. So the same foods that affect help us with menopause, right, potentially are going to help us with the controversial andropause symptoms as well. There is no proven food that will increase testosterone. There are things that can help, okay, but there is no proven food, because if there was a proven food that would increase testosterone, it would cause risk to people who have prostate cancer. Right? Because prostate cancer is a testosterone-sensitive cancer. Okay, so we would tell prostate cancer patients, do not use these foods because they're at risk of increasing your testosterone. They're foods that can help, as I mentioned, with a healthy diet, right? Eating more omega-6, and avocado is one of those that have omega-6 and 3 in it. So that would help, but there is no proven food for increasing testosterone. Just like some of the supplements that you will see sold on TV, etc., are not proven to increase the testosterone, but they may make hormone-sensitive cancers more sensitive to what you're taking. Yes, you wanted to follow up your question?
Yeah, I don't want to appear defiant, and I don't want to drag out the conversation for too long, but these are research studies that were done actually on mice and humans, and it actually showed increase, well, with the exception of the honey, but all the rest showed increase of testosterone levels by at least 25%.
And so what? And what
So
was the
I
point?
was asking specifically which foods, if you have any recommendations.
Right. So you have a research study that is done on animal models, right?
Multiple, yes,
Okay. And animal models
and
are,
humans.
and they're being trialed for what reason? What's the reason for the increase in testosterone studies?
Let me go back to this page.
Though I'd be happy to see the studies and review them.
Yeah, it
'Cause
seems
that's
as
what
though
I-
I have a new interest. We can talk afterwards.
Sure, right? I'll just leave it to say that if they're doing studies to say, well, you need to increase the testosterone, then those foods may also cause risk to people who have early prostate cancer. So I'd be interested to know what those are. I know there are foods that can help you prevent prostate cancer, right? We think lycopene and eating tomatoes and those sorts of things are really important. And carotene-rich foods like pumpkin and pumpkin seeds and so on and so forth, and carrots. Those are important in helping prevent prostate cancer. But if you're going to try to increase testosterone in men, I'd want to know why you're doing it, okay? And treating low T, as I said, is a controversial thing. Yes. Oh, sorry, pass.
Dr. Williams, how long is menopause supposed to start? From December the 16th, 2019 till today, I get a hot flash every hour. Sometimes it's every 30 minutes, 35 minutes, could be 40 minutes, but it's constant. And I was telling Brian, I feel that something wrong with me because
No,
this is,
nothing
and I
is
was
wrong.
wondering if it had anything to do with my Graves' disease or the hyperthyroidism, because I was diagnosed with that many years ago, but I'm now in remission. He thinks that I drink too much coffee, but I don't drink. The little coffee packets, cappuccino, I would drink half on mornings, but I don't drink a whole packet. But and I love my coffee and I love my tea. But couldn't it be something else? And now the gentleman there is saying something, it could be psychological.
No, he didn't say it was all psychological. So
No,
I think you misunderstood what he was saying.
Perhaps I
He was
did.
saying that psychological makes stressors and our modern lifestyle make it worse. That it is a natural phenomena. I did not say this because I didn't want to, scare anybody. But you can have menopausal symptoms up till you're 72, 75. There are people who are
Even
in
so, Lord Jesus,
early
completely.
80s that are still exhibiting menopause symptoms.
That is not good news, Dr. Williams.
That is the truth. I'm sorry, but it is true. But it does not have to be that way, and it will not be as bad as at the end.
It
as-
will lessen.
It will lessen. It will lessen. But certainly, you're telling me 5 years? That's
Yeah.
quite normal.
So tell me about I didn't know about the estrogen patch.
Right.
And the vaginal thing. So
Right.
talk to me about the two of them, particularly the patch, because I'm so desperate right now. I'm ready to go to my gynecologist tomorrow and ask him
Well,
about this patch.
you need to go to your gynecologist and ask him. But really and truly, yes, they do exist. They're here in Barbados. They're a bit pricey. They are a bit pricey, okay? But, and because we sweat a lot, patches tend to come off and you have to replace them.
Okay.
But there are gels as well that women use. So those are safer. And if you're really, as I said, if you're really going through the symptoms and you're doing all the other stuff, remember the exercise, the diet, the sleep, and all of those things, you're doing all of those things and you're still having lots and lots of symptoms, you have the psychological support and all of that in place, but you're just not able to function, this is where you need your medical team to step in and help you. And that's why I told you there's HRT now that does not have the risks that those pills used to have years ago. There are estrogen gels, there are estrogen patches, and there are vaginal estrogens that can literally make the woman feel like, okay, I can exhale again. So that there's, all hope is not lost. And 5 years would be a very normal time period. Yes.
That's normal.
I just want to address, as you said, you know you're wrong because the coffee and the tea. I know you can
So
look
even
at me.
a little bit?
A little bit of poison, a lot of poison is still
So
poison.
you telling me that I gotta start drinking my coffee
Oh,
for
no,
the
you can have the
morning?
hot flashes every hour. That is up to you.
I beg your pardon?
Or you can have the hot flashes every hour. You have an option.
So,
I'm listening. Not be extreme.
but it's
Sorry.
only once a day have it, you know.
I'm just saying is that with, and the daughter, my daughter, with the hypothyroidism, and you're having something that's stimulating your endocrine system, it is going to, I'm not saying it's solid, but I give it to the doctor.
Okay.
Yes, he's correct.
Okay,
If
thank you.
it depends, you know, if you're drinking an espresso or a very strong coffee, or you're having black tea and green tea and all of those caffeine, those are all caffeinated drinks.
I love that.
Coca-Cola, Pepsi, all of those are caffeine. There are multiple sources of caffeine out there.
Of course.
And you might say, oh, I'm only drinking 1 cup of coffee, but you're having all of those. Yes, it can contribute to menopausal symptoms.
So if
It
I do
does.
a test and I stop drinking caffeine for a whole month and I'm still having them,
You shouldn't, if you start drinking caffeine suddenly like that, you're going to have all kinds of other symptoms. You can get headache and some everything else. So what
gotta
I would
ease.
tell you is
I have to wean myself off.
ease down some coffee.
down.
Have some coffee-free, caffeine-free days. Have
Okay.
decaf.
Right.
It tricks the brain into the fact that you're still getting stimulated.
Okay.
Do half and half coffee, half decaf, and wean it down. Have
Okay.
some coffee-free days.
Okay.
Right?
Okay.
Good.
Good. Thank you. That helps.
Doctor, I just want to say vaginal, I'm giving the pastor very quickly, the vaginal estrogen, yes, because I know a lot of women don't know about that, but I have, and the lubricants also, if that is a thing.
So vaginal estrogen is available as, there are different brand names here. It's something that you would be given to insert, say, every night for 2 weeks and then twice a week thereafter, okay? And it, you know, we're accustomed to, you know, treating yeast infections and having inserts and so forth. So it's not messy like that. It's just tiny little bit of estrogen, and it relieves vaginal dryness almost completely. In Europe, it's over the counter. You don't even have to go to a doctor to buy vaginal estrogen in Europe, okay? But here you do, and it does cost a little bit. I'm not sure that insurance will cover that because, again, a lot of women's conditions are not covered by insurance. It's very sad, it's wrong, but that is a fact. That's a fact. A lot of women's conditions, particularly something that they're going to consider natural, like menopause, I doubt very much that they're going to cover prescriptions for vaginal estrogen, but they're out there. Yes, sorry, Pastor.
Sorry, Dr. Williams, my question is, you had, there one of the things to help relieve the menopause symptoms is soy. And I know before there was a concern that soy could lead to breast cancer and these types of things. So I just wanted to question that since it was on there.
Soy doesn't lead to breast cancer, or all the women in the East would have breast cancer, right? All the Japanese women would have breast cancer. They eat soy from the time they're children right up until they're 90, okay? So soy in itself does not cause breast cancer. The reason why that theory is out there is because it is a estrogen mimicker that helps to ease the symptoms, okay? Too much of anything is a bad thing, but everything in moderation has some benefit. I think that's a biblical principle, right? So not anything, obviously, but obviously when we're talking about food, if you overdo anything, you can go into the realm of the bad. But if you eat something in moderation, it's in the realm of the good. We don't get much yam these days, you know? But yam is one of those foods principally, especially yellow yam. I don't know the last day I've seen that, okay? But those kinds of foods help to ease some of the menopause symptoms as well. They're not going to take it away. You're not going to eat yam every day. You understand? Because then you'll have other problems, right? But, you know, having a balanced diet that contains more complex carbohydrates, yam, cassava, you know, what Bajans used to call bread kind, those things help to balance the hormonal symptoms as well. Yeah. Yes.
One of the last things that I do recommend, my client says something called intermittent fasting, and that has been also shown scientifically. Those doctors are throwing out there. With fasting actually assists with the symptoms of menopause. I don't know if you've ever heard of that, Doc.
Intermittent fasting, I don't have time to go into it all, but what I will say is this. When I first read it, I thought, oh, well, that's how I've lived for the past however many years, you know. And as Christians, we fast, so it's nothing new to our bodies. Doing fasting intermittently, like how I've seen some of the regimes, it depends, it's individual. Anything that is for everybody is for nobody. That's why I'm going to leave it to you to figure out that everything that is for everybody is for nobody. You are an individual. Your individual needs have to be discussed with a health professional for you. There's no blanket, one size fits all. There's no blanket, if you do this, everybody else gets results and you will too, okay? When you come to a medical professional, we're looking at you, and only you, okay? So yes, we look at studies, we look at, you know, what will work, etc. But we recognize that every individual has their own nuances. So whether or not intermittent fasting is right for you is a conversation you should have with those who are trained in diet and nutrition and so forth, and with your doctor. Whether it's right for you, you may have some other condition that I don't know about. Okay, so I can't recommend or not recommend it.
Dr. Williams and Mr. Brown, we really appreciate your in-depth study and professional advice. It was a great pleasure. We really appreciate you. On behalf of the Marriage and Family Ministry and the leadership and membership of People's Couture, we really thank you and appreciate you. Sorry that our time is gone, but we are really grateful and we really think that that information was very valid at this present moment. So we want to say thank you. God bless you all.